Hey guys, this is Dr. L, and we're going to think a little bit about toxicology in the context of medications or drugs, or also known as pharmaceutical agents. We're going to look at the dose-response curve, which is a really important concept in toxicology, considering some different endpoints, especially the endpoints of effective dose and toxic dose. We will define the term drug in a medical sense, and we'll talk about ways you can measure the safety of a drug, specifically the concepts of therapeutic window, therapeutic index, margin of safety, and selective toxicity. And then finally we'll conclude by talking about who's responsible for regulating drugs in the United States. And again, by drugs I mean medically useful drugs. So we've looked at this before, and it's also in your reading. This is a dose-response curve. The dose is the amount of a particular chemical that has actually been absorbed in this case by the human or the test animal. And so there'll be some amount of chemical measured in milligrams divided by the individual's body weight in kilograms. So that unit shows us this is an absorbed dose. And the vertical scale is response in percent. So how many, what percent of organisms, test animals or, modeled people are we seeing is what's on the vertical axis. So we've looked at this before. This curve tends to be sigmoidal or S-shaped. Where the slope is the steepest, you will have the fastest or the greatest response for every amount of increase in the dose. These curves are really useful for determining a lot of various measures. So for example, determining the lethal dose of 50% of the test animal or test system, right? You go to the 50 over here, you walk it across, you drop it down, and here this is like somewhere around 21 or 22 milligrams per kilograms. That's the absorbed dose that will kill 50% of the organisms tested. This is a statistically determined number. Lowell and Noel are the lowest observable or no observable adverse effect level, and so on. So the lethal dose of 50%, it's a very old concept in toxicology, and more recently there's been, in recent decades, there's been a movement away from LD50 as a way to determine the acute toxicity for any given chemical, because it requires the use of animals and a lot of animals, and this raises many questions of ethics. So in modern research, we try to think about an approach called the 3R approach when we're evaluating acute toxicity. So we try to replace animals in research wherever possible. For example, by using computer modeling or cell culture or other approaches. We try, if we have to use animals, we try to reduce the number of animals used in a study by changing experimental design. And we try to, if we do have to use animals, we try to refine the care to minimize stress and pain for any animals that are used, and we look for other endpoints besides lethality to measure acute toxicity. All right, so this is a figure that I've shown you in a previous lesson, but let's consider endpoint. Like when you're doing an experiment, what's the endpoint of the experiment? What are you looking to determine? So the endpoint could be lethality or killing, right? And so this is the dose-response curve for that. This shows us this 50% would be 50% dead organisms in your research study, right? And if you drop it down, you're going to see some concentration that achieves that endpoint, right? And this is a log scale across the bottom, by the way, which is smoothing these curves out. Instead, your endpoint could be a toxic effect. So it could be some other measure like loss of some function or change in temperature or, some other toxicity, inability to reproduce. There's all sorts of different toxic endpoints beside lethality. If you specified one of those and you determined the relationship between that toxic effect and dose, then you're going to be evaluating what's called the TD50 or some other level where This would be 50% of the organisms are showing that toxic effect at this concentration. And it's going to be, if the toxic effect isn't death or lethality, that curve should always sit to the left of the LD50 curve. Over here on the far left, we have the ED50, which is the effective dose for 50%. And this is often really important for medicines or drugs or pharmaceutical agents where we're looking to see some other biological endpoint. Like maybe this is for aspirin, and you're looking to see, do you get rid of the headache in 50% of the people that take this, and at what concentration, what dosage does that happen, right? So the effective dose, for aspirin would be getting rid of the headache, right? At higher concentrations, there is a certain amount of aspirin that will absolutely kill people, right? And that's lethality is that dose over here. And then there's going to be in between, there's going to be toxic effects from taking aspirin, like maybe stomach bleeding, and that would be this curve in here. So this curve would be the effective dose for a medication, some sort of beneficial, thing that you're achieving by taking the medication. That's your ED50 curve, your toxic curve, some sort of harm other than lethality, and then your lethality curve, right, where the endpoint is actually death, a pretty crude endpoint, okay? So the therapeutic window is going to fall in this range. It's going to be between the effective dose and the toxic dose. And the bigger the therapeutic window, the safer the drug, because ideally we would want to have these curves as separated as possible. Let's think more about that. This is an area of toxicology called pharmaceutical toxicology. So this is an area you can specialize in if you're a toxicologist. It is the study of the adverse effects of drugs or pharmaceuticals on people or other organisms. So these are the people that study side effects or toxic effects or off-target effects that are negative. And so let's define what a drug is. So I took this from Wikipedia. So in pharmacology, which is the study of drugs, a drug is a chemical substance, typically of known structure, which, when administered to a living organism, produces a biological effect. A pharmaceutical drug, which is also called a medication or medicine, is a chemical substance used to treat, cure, prevent, or diagnose a disease or to promote well-being, right? So these are chemicals of known structure that are biologically active and that can be used, generally speaking, to improve health. That's what we mean by drugs, okay? Which is different than like arsenic, which you get from drinking contaminated water if you are drinking certain well water in New Hampshire that's untreated. And that's, you're not taking that arsenic for anything beneficial. It's just a toxin or just a poison, right? So here we're really kind of focusing in on medications. The therapeutic window I defined before, but it is the concentration range at which a drug is effective, positively effective. It's doing something beneficial. It's effective enough, but not yet too toxic. That's what the therapeutic window concept means. How do you know a drug is safe? It has a big therapeutic window. It will also have a big therapeutic index. So the therapeutic index, or TI, is a ratio of the toxic dose, usually for 50% of the test organisms, divided by the dose that is medically effective. So it's your TD50 divided by your ED50. And usually this is done at the 50% response rate. When you divide those two things together, you get something called a therapeutic index. The larger the therapeutic index is, then the less toxic or the safer your drug is. So bigger is better. We want drugs where the toxic index or the therapeutic index is as big as possible. This is related to the idea of margin of safety, but instead of using data taken where you were looking at the 50% of your test animal population, you're looking for something a little bit more subtle. So here we can determine what's called a margin of safety by determining the dose at which the toxic dose for 1% of the test animals. This is going to be smaller than the toxic dose for 50%, right? So the toxic, where we see toxicity in 1% of our test animals, divided by the effective dose for 99% of your test animals. And we want to have a large margin of safety, right? So bigger is better for this as well. Let's consider two kinds of drugs to sort of in our thinking here: antimicrobials and anti-cancer drugs. These are both kinds of drugs, right? An antimicrobial is a drug that you take to kill a pathogenic organism that is infecting you, that is within you or another animal. So these are things like penicillins or amoxicillin or ciprofloxacin or streptomycin, right? These are drugs that you take when you have strep throat, when you're trying to kill the bacterium, not harm yourself, okay? Or let's think of another category, which is anti-cancer drugs. These are drugs that we take to kill tumor cells. These are cancerous cells. We want to get rid of them. We want to clear them from the body, but without harming the host, right? So in both cases, we want to kill one kind of cell, but not kill the main cells of the host or human body. And this is the idea of selective toxicity. It's a concept that was first described, or at least that is credited to a German chemist, Paul Ehrlich. And he describes something called selective toxicity, which is the ability of a drug to be highly effective while also being minimally harmful. It's the goal, right? So high therapeutic index or margin of safety equals high selective toxicity. In antimicrobials, if you have good selective toxicity, it means the drug can kill the pathogenic microbe but not harm the human. For anti-cancer drugs, good selective toxicity means the drug will kill the tumor cells, but it won't kill the rest of the humans. So you won't have a lot of adverse side effects from that chemotherapy with your anti-cancer drug. This sounds simple, but it's actually quite hard. So there are like thousands of chemicals out there that have therapeutic effects that are desirable, like thousands and thousands. But the problem is a lot of them also have adverse effects, and the therapeutic window is too small. So the selective toxicity is not good, right? And so they're not useful for drugs because we can't get the benefit without also poisoning the human. So that is actually really hard to find. And requires a lot of research, right? A lot of research, a lot of careful testing, right? And so regulation of new drugs requires that. So the Food and Drug Administration, or the FDA in the United States, is the governmental body that is responsible for looking at the data that a company is saying, like, we want to present this new drug, it's really useful for this. Well, they have to prove that it's useful, and they also have to prove that it is not toxic, that it has good selective toxicity. And that is done in a very detailed and regulated process, strictly controlled by the FDA. And that's the topic of another video lesson. And that concludes this lesson.